Hello guys, this is Dr. Evans and today I'm going to talk about endometriosis. This condition normally affects women between the ages of 20 and 40 years of age, and I've come to realize that it's becoming relatively common in our hospitals today, and that's why today we are here talking about it. So what is endometriosis? In brief, endometriosis basically means the occurrence of endometrial tissue outside the uterus. We all know that endometrial tissues are the ones that thicken, breaks down and bleeds out during each menstrual cycle. And you can only imagine what will happen if we have this endometrial thickening in other body parts other than the uterus. So what are these other body parts? We have the pelvic organs, the normal ones, the ovaries. This is the most common site for endometriosis. We have the fallopian tube, we have the cervix, and you can also have it in the bladder. Outside the pelvic organs, we can also have endometriosis in the gallbladder. We can also have it in the breast. And with this, we are expecting an enlargement and it can be excised. We can also have endometriosis in the chest cavity. This we'll call it thoracic endometriosis, whereby we'll mostly have pneumothorax or hemothorax during the menstruation times. And these patients will present with cough, chest pain, and symptoms that are similar to those patients with pneumonia. Therefore, you have to be very keen when you meet such patients. We can also have these endometrial tissues at the scar area. Let's say, for example, you have done your cesarean section, perfect cesarean section. You have done your fanning style incision. You have entered inside, done your Lucy, extracted the baby. At this point, there's very high possibility of iatrogenic transplantation of the endometrial tissue from the uterus to the wound area. With time, this patient will start presenting with low abdominal pain that is cyclical at the incision area. Interestingly, we can also have cerebral endometriosis, whereby we have this endometrial tissue in the brain area. Actually, there's one case I read somewhere of a patient who had presented with abnormal gait, headaches and seizures, and after multiple CTs, they could locate an intracystic hemorrhage and they found out that it was an endometrial tissue. But this begs the question, how could an endometrial tissue come from the uterus to the brain area? It turns out that during infancy, this patient had congenital hydrocephalus and she had to undergo multiple ventriculoperitoneal shunts, revisions and repairs. And most probably this could be the cause for the endometriosis, because I'm thinking the shunt could have acted as a conduit or a conductor for transplantation of the endometrial tissue from the uterus to the brain. Of course, I can't ignore the fact that there could be also hematogenous spread. So on that note, what causes endometriosis? The number one on my list is retrograde menstruation. This is where we have the backflow of menstrual fluid from the uterus to the pelvic cavity through the fallopian tube. We know very well that the menstrual fluid is supposed to flow through the cervix to the vagina and outside, but in this case, the fluid goes to the pelvic cavity. This is caused by asynchronous contraction of the uterus, which pushes the fluid in the opposite direction to the pelvic cavity. Yes, this is normal, but with time, the endometrial tissue builds up and can cause pressure to the nerves, leading to the pain and swelling and inflammation. Number two, we have hematogenous and lymphatic spread of the endometrial tissue to the other sides of the body. Third one, we have the iatrogenic transplantation, which I've already said during the surgical procedures. The last one is hereditary. Sometimes these genes are transmitted down the familial line. So what are the symptoms of endometriosis? We have the chronic pelvic pain. Endometriosis can also cause infertility, and this normally happens when they form adhesions at the fallopian tube, blocking the area, hence preventing fertilization. Endometriosis can also lead to symptoms in other areas. For example, when it goes in the intestine, it will lead to diarrhea. Sometimes it can lead to constipation. If it occurs on the chest region, it will lead to coughing, chest pain, hemothoraxis and pneumothoraxis. If it occurs in the urinary tract, it can lead to painful urination or dysuria. If it occurs in the brain, it will lead to the headache, seizures. So basically, these symptoms depend on where the endometrial tissue forms. So the best way to diagnose endometriosis is through thorough history taking and physical examination. And then the second thing you have to do is the transvaginal ultrasound. With this, you notice the chocolate cysts, which point out to endometrial tissue. Another way to diagnose endometriosis is through laparoscopy, where you will see the implants, and then with this you can either surgically remove them. When it comes to management, we have both the medical and the surgical procedure. When it comes to the medical, we can give painkillers, which are the NSAIDs. We can give combined oral contraceptives. We can also give progestin only contraceptive. We can also give gonadotropin releasing hormone agonists such as goserelin. These medications will help in the downregulation of the pituitary gland, and they also prevent the thickening of the endometrial tissue. Remember, these drugs are supposed to be given between 3 to 6 months unless the patients want to conceive. When it comes to the surgery, there is laparoscopic removal of the implants, and we can also have sometimes hysterectomy with bilateral salpingo-oophorectomy. Thank you so much for listening. If you have any questions about endometriosis, feel free to contact me through the email below. Have a nice day. See you on the next one.